Hello, everyone. Welcome to our webinar today. This is Ask Sheila, IBCLC. You'll get expert answers to your breastfeeding questions. This event is presented by Healthy Horizons, whose mission is to empower breastfeeding parents at work and at home. Healthy Horizons is the first company to offer comprehensive lactation at work benefits at scale across North America, and they support breastfeeding families with lactation consultations, support groups, and breastfeeding and baby products. Before we get started with our Q&A session for today, we did want to make you aware of Healthy Horizons contest that is going on this month. Healthy Horizons has partnered with a group of generous sponsors to give away more than $6,500 worth of prizes for breastfeeding parents at work and at home. Through August 31st, you can nominate a deserving organization to receive a lactation room upgrade, and that'll include equipment and supplies to support breastfeeding parents at work. In addition, moms and parents can be entered to win baby prizes by following Healthy Horizons on Instagram and Facebook and tagging your breastfeeding friends in our posts. So you can learn a little bit about how that contest works by taking a look at the slide on your screen and then checking out our Instagram page. And there's a link at the bottom of your screen as well to learn more about those opportunities. All right, and now it is my pleasure to be able to introduce our speaker for today. Sheila Janakos is the CEO of Healthy Horizons. And in this role, she brings 30 years of experience as an internationally board certified lactation consultant. She has a master's of public health, and she has been using those skills to serve breastfeeding families for the past 3 decades. Sheila, we're so excited to have you today to be able to share your expertise with our group.
Thanks, Jenny. I'm looking forward to the questions.
Awesome. And to our breastfeeding moms and dads and caregivers, and we have some healthcare providers and practitioners and interested parties on the line with us. So we do have a number of questions that were submitted via the registration form ahead of time. We're going to start with those. And if you have a question for yourself, we would encourage you to feel free to share that in the comment section if you're watching on YouTube or Facebook, and we'll address as many of those live questions as we can as well. All right, so let's see here. Let's kick it off with the first question from Sarah. And this is one that was submitted via registration form ahead of the program today. So Sarah has asked, what can you do while you're pregnant to prepare for a good first breastfeeding after the baby is born?
Excellent question. The most important thing that you could do is to educate yourself. So that would be reading books and taking a class. That would be the first step. So you'll know what to expect. I think if a person knows what to expect during those first week, 10 days, pretty much they'll not get thrown off track as easy. Like to know what the normal changes are in the baby and in the breast, etc. The other thing I would do is probably schedule a personal prenatal consultation. That way you could talk with a lactation consultant one-on-one about your particular breastfeeding needs and what your goals are. And maybe you had breast surgery or you had a history of low milk supply, things like that would be important to let the consultant know so she could help work or he could help work a plan for you. So basically it's education.
Yeah, good point, Sheila. And there are so many unique situations during pregnancy that that's good advice that maybe it's a good time to get involved with a specialist or lactation provider if you have unique concerns.
I would say a third of what we do are prenatal consultations, Jenny. And most of those are online, and people could just go to healthyhorizons.com and book that. But I think that that's really important because it gives people that opportunity to do that one-on-one and really get specific.
Yeah, that makes sense. And you might not think about that before the baby is born, that's an option for a mama. That's great.
And then you could connect with somebody before and then maybe hopefully after the same person.
Great. All right, Sarah, thank you for that great question. We hope it was helpful here, and we're going to move on to the next question, which is from Juliet. Juliet has asked, how do you treat and prevent a stubborn recurring milk blister? And maybe for some of us, Sheila, you can tell us what is a milk blister and how to identify one.
Sure. Milk blisters have different names. Some people call them milk blisters. Some people will also refer to them as a bleb. Other people will call them a clogged milk pore. So they could present in many different ways. Typically, what a milk blister is the tip of the nipple has many pores. And one of these pores where the milk will exit gets blocked with thickened milk. And when it gets blocked, there's inflammation. So if this was the milk stuck inside of the little blister, the pore, it forms a blister. Like here's the little plug. The body doesn't know what to do with it. So there's a lot of epithelial milk cells in the milk. And it really is great because it causes things to heal. So the body goes, oh, I need to heal this. So it makes a little blister over the tip and it could be so painful. So how do you prevent this? There's a couple things that people could try and do is, first of all, typically they're a result from a plugged duct, which is a blockage further back in the breast. So keeping the breast emptied and not skipping feedings is a big one. So sometimes people will go away and they won't pump, or the baby will sleep longer and they won't get up and release the milk. Sometimes those could be reasons. I've had people also like wear a seatbelt or a baby carrier and put pressure against their breast, and that causes the backup. So think of the things that you might be doing that will put pressure on the breast. And the remnants of this typically is this plug. So for people who get repeated ones, one of the treatments is something called lecithin. And lecithin is a fat emulsifier, and it just basically thins out the fat in the milk. So there's less chance of it clogging. And people will take like 1,200 milligrams or so typically with their meals. It's something that people can get anywhere, pharmacies, you name it. It's not a prescription. It's basically a food supplement. So that's something people could do. The other thing that I tell people, if you have a history, you want to make sure that you're keeping any nipple trauma to a minimum and inflammation, because if you have a scab also on your nipple or inflammation, you're more prone to getting a milk blister, right? Because things can't like really leave. So making sure that the latch and everything is correct and treating those issues before they get worse. One of the treatments is to take the nipple and soak it in warm water. And I just take a shot glass, and you could put a pinch of Epsom salt or use the herb lore poke root, which would just be a couple little baby drops in the shot glass. Put the nipple in the shot glass against the nipple and let it soak for several minutes to soften the area up. And then I rinse it, and then I have the baby nurse or we pump to try and pull it out. So we want to soften first and get it out. And then afterwards, we can take a cotton ball and we can soak it in either olive oil or coconut oil. And we can put it against the nipple behind a bra pad to keep the area moist so it doesn't get dried. And that could help too with people who are dealing with these.
Who'd have thought we could still find a use for shot glasses while we're breastfeeding?
Right. Well, some people do wheatgrass, right? Shots. So.
Oh, yeah. All right. Thank you, Juliet. Good question and good luck. And if you have more questions, feel free to chat with us afterwards too. We'll try to see what we can do to get you resolved. Now, Stephanie has asked for tips about helping baby with better milk transfer. And then as a piggyback onto that, how to move from exclusively pumping to getting baby to nurse when the doctor is concerned about low weight gain. What advice can you give Stephanie, Sheila?
Well, that's like a lot of questions within a question, so I'll try to dissect this. How do you help a baby with better milk transfer? The first thing would be to get a deeper latch, right? So if a baby's on deeper, the baby's going to be able to compress the tissue and draw more milk out. If the baby's just on the tip of the nipple, it's going to impact how much milk the baby's able to take. So one of the things is obviously get that deeper latch, but there's something called breast compression, and that's where you put compression on the breast and kind of move forward during the feeding. And I do this when I hear the pause in the sucking. So the baby suck, swallow, suck, swallow. And when I don't hear the swallowing, that's when you compress and kind of pull down a little bit, and it pushes some milk out. So it helps with the transfer. It also helps keep the baby more motivated at the breast. So that would be my answer to part one. How do you move from exclusive pumping to getting the baby to nurse when the doctor's concerned about low birth weight? Well, what I would say is getting the baby on the breast is probably the best thing, because the baby's going to be able to practice and help get that milk supply up. There is a feeding device that Haka has come out with recently, and it's fabulous. It's called the Haka feeding tube. And I love to use that in my practice. And this Haka feeding tube, you put one end in a baby bottle, that the tip goes into the milk, and the other end is a tube, and you would thread it into the baby's mouth or put it on your nipple and latch the baby, and the baby gets to nurse and practice and stimulate your milk supply while getting the supplement. So it's like the best of both worlds, and it really does motivate the baby to do a better job at the breast. And that's a really great way to kind of move from the pumping to exclusive breastfeeding. I probably would have, depending on the situation, the lactating parent still pump several times a day so they could have some supplement if possible to keep the milk production and the intake even. But that would be one of my suggestions.
Okay, great. Thank you, Sheila. And Stephanie, thank you for those comments, and good luck with your breastfeeding journey. Okay, let's see. Next we have a question from Lana. Lana's baby spits up in bed even an hour after burping, and sometimes has painful gas. So she cries and then farts or poops. We're all mamas. We've all experienced it.
This is so challenging, right, Jenny? I think all of us.
This. Yep. Mm-hmm. And you don't like to see the baby feeling uncomfortable.
No. And this causes so much stress for parents. But one of the things I like to tell people, spit up is normal. Physiologically, I mean, babies spit up. Their little valve, it's called a sphincter, and their little stomach is still like developing. And so if the tummy gets overly full, it's really easy for the baby to spit up. So movement can make this worse, and also a rapid feeding. So one of the things that we could maybe try is to maybe feed the baby in more of an upright position. Maybe have the baby a little bit more straddled even, or sitting on the lap and coming up, so the baby's not getting all that milk with gravity. So a little bit more slow, controlled feeding might help with that. Studies have shown that parents who burp versus parents who don't burp do not have better outcomes. And our society is so into burping, like we're always burping, right? But we found in other cultures, they may not burp, and we may think that's strange, but they think that the burping is strange. Sometimes all that movement and that patting causes more spitting up.
Interesting.
So actually the study showed that sometimes there was more spitting up with the burping. So I would say the controlled feeding would be helpful. Now the gas and the farts and the poops have nothing to do with what's going on up here with this kind of gas, right? It's not like that bubble's just going to move on down. And all the burping in the world isn't going to take care of a lower GI issue. And that's something we just think it's all connected, but it really isn't. So when I hear people complaining about the farting and all these poops, it's an immature GI tract. This little gut is learning what to do, and it has to deal with the milk and all the volume, right? And it's digesting. And throughout the day, breast milk is high in lactose. So all those sugars kind of ferment, and it can be quite explosive in the late afternoon, early evening. Typically between 4 and midnight, we see this. What I suggest people do is to try and be preventative. Not after feeding, I wouldn't do this, but I would do tummy massage throughout the day during diaper changing. And I would make it clockwise movements, or the I love you, just keeping the gut moving, right? Do that little tummy massage, get some coconut oil, warm it up in your hands. So keep it moving. You could do some bicycling, get that gas out throughout the day. So in the evening, we're not just having this explosive baby. I promise it changes. This behavior kind of starts around 2.5, 3 weeks, peaks around 6, plateaus between 6 and 8, and between 10 and 12, it's so much better.
Yeah, that's great feedback. Thanks for that, Lana. And Sheila, we've gotten a question from the live stream audience. I'm going to go ahead and share that one on the screen here.
Okay.
From Lee. Hello, Lee. And she has asked, how do I know that the baby is getting enough milk if I'm nursing exclusively? She was pushed to supplement with formula for her first baby, and she felt such guilt. This is probably not the only time this has happened, Lee. You've got others.
Unfortunately, so many parents are pushed to do things, and we all feel guilty about one thing or another with our children. So it is hard. It's the hardest part, right? So how do you know if a baby's getting enough? We would check the weights. If the baby is gaining at least the 4 to 7 ounces a week during that first 3 months, that's the indicator. A baby couldn't gain weight if the baby wasn't getting enough. So that would be one of the markers. I would also look to see what the baby's output was, like how many wet and poopy diapers. Now, during those first couple of days, the milk supply is not going to be fully in, and it was never designed to be fully in. It's a gradual increase. The baby's tummy is the size of literally a blueberry, so we don't expect this baby to take ounces. So we do expect some weight loss during those first couple days, probably the lowest weight on day 3 and day 4. And day 5, the baby should be stable and start to gain after day 5. So that's what I would look for. Is the baby starting to gain after day 5? Mm-hmm. We all lose weight during those first couple of days.
Yeah. So, and it's so scary. That weight loss is scary.
So if you're pushed to supplement, one of the things I would do first is to look at what all those other markers are. And if truly those markers were low, the first thing I would try and do is boost my milk production and work on the baby's milk transfer. So that might be a time where we could do some pumping and then maybe supplement at the breast with like the Hakatu feeder. But I think you are the norm. This is what most people tell me happens. So I think getting the right education and surrounding yourself by the right support people is probably critical.
Yeah. Thanks, Lee. Great question. And we've got another live one from the audience. Gia, hello, Gia. Sheila, you're going to have to help me with this one. Do you recommend galactagogues? I don't know what that is. So
let me explain. A galactagogue is actually an herbal supplement that helps you produce more milk. So if you go back to the talk we did with Pam Caldwell, we talked a lot about galactagogues. So I tell people if it's not broken, I don't fix it. I wouldn't take anything unless we're truly feeling like there's a milk supply issue. If you had a natural unmedicated birth and the baby is latching well and you're feeling like things are moving along, just stay with that. You're doing good. So I would say in cases of low milk supply, then I would look at it. But if everything's going well, I would just enjoy the baby.
Yeah. And for our audience, actually, Sheila referred to a webinar that we had last week with Pam Caldwell of Herblore. where she talked about herbal supplements. And if you're interested in that, you can check it out on our YouTube channel. There's a lot of great information.
Yeah, and she talks about the ones that she feels are the best, and I think it's great.
Thank you, Gia. All right, and feel free to keep those questions coming from our live stream audience, and we'll move on with the previously submitted questions as well in the meantime. Alicia has asked how to nurse a baby who has tongue thrusting habits. What are your thoughts on that, Sheila?
Well, I'd want to find out why the baby's tongue thrusting, first of all. So I would have a lactation consultant take a look and make sure that it is not caused by maybe a hidden tongue tie or some habit the baby kind of formed during birth. One of the simple things that we do if it's not a structural issue is to try and let the baby practice nursing on a finger. And what I do is I do a clean finger. I trim my nail. I put my finger in the baby's mouth, pad side up. And I get right against the palate. I get the baby to start to suck. Because what I want the baby to do is to kind of grab onto my finger and kind of cup the tongue and to practice. So I try to get the baby into a little practice state first, and then I try to get the baby onto the breast. And that's one of the things that could really help early on if it's not a structural issue. I would see a lactation consultant, though, to rule out like a hidden tongue tie or something else.
Have myself on mute. Thank you, Sheila. Good point. And thank you, Alicia. Good luck with this baby. We have more from Alicia. All right, so maybe I should
see, there was
a around the screen. Yeah. I think you had a premonition about the tongue tie. Okay, so now in addition to this, what do we do when the baby is 11 plus pounds? We've got a big baby. How do we successfully find a position that's going to be comfortable for both mom and baby?
So I'm seeing two parts to this question. The first one is nursing after the lip and tongue tie reversal. Mm-hmm. So I would hopefully be doing the exercises, letting the baby suck on the finger and trying to retrain that tongue. There are aftercare exercises for a lip and tongue tie, and I'd be following those instructions that the doctor or the dentist gave you to make sure that there is not closure of the wound and that things are healing well. Positions. An older baby or a larger baby, it might be hard to do a cross cradle where the baby's being supported by one arm, right? So this might be a time where you would latch the baby first and then go into more of a cradle hold. But first get a really nice deep latch. And then you could also lay back. And that way the baby's more on top of you and you don't have to support the baby as much. And so that's a nice way to kind of position a baby. Also, that upright position that we talked about is really good for babies who had a tongue tie because it helps the tongue drop also. So that's another position. I know it's tough to hold a big baby like that, but the more laid back and the cradle after a good latch is probably going to be your best bet.
Use gravity to your benefit.
Correct, because otherwise people get these really sore wrists, and we want to find ways to kind of minimize that.
Yeah. All right. Thank you, Alicia. All right. Now we have two questions about latching. And Sheila, I know you talked a little bit already on, I think it was Stephanie's question with respect to latching, but Sonia has asked about how to correct a latch. And I'm going to lump these two together. Fayan has asked, how do we get a baby to latch better? Same question to mamas here.
Okay. Well, first of all, I don't know how you did this, Jenny. You're brilliant. This is the picture of what I was just talking about.
Oh, there you go.
So that was really intuitive that you knew to do that. But here's a picture of a mom nursing an older baby, and the baby's straddling her basically. This is a great position. So thank you for knowing to do that. So it's pretty exciting. So how do you correct a latch and how do you get a better latch? Well, the first thing to do, I think, is to, if it's a really new baby, what I do is with the nipple, I tickle right underneath the nose. And there's a trigger there, and it causes the mouth to open. So you tickle, 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 that mouth opens. As soon as that mouth opens, let's say this is the baby's mouth, right? This is the baby's lower lip, upper lip. Let's say this is the nipple. So we're tickling the baby right underneath the nose. When the mouth opens, I take that lower lip and I attach it to the areola right away. So that comes on first, and I bring the baby up and over. It's kind of like eating a sandwich. So, first the lower part of the mouth, right, hits the sandwich, and then you come over. So I'm trying to get that baby on as deep as possible. And that would be a more comfortable latch. The baby's going to remove more milk. If your baby tends to come on with a closed mouth, doing this is super helpful to get the baby to open. What I see a lot of people do is they'll tickle here, and then the baby goes like this. That's not going to help with latch. We want to come chin first. And bringing that baby in really tight, tummy to tummy, held against you, is much easier, right? Because then the baby's right there and can get on. So really supporting that baby. The other thing I see people do is they'll do this. And the babies have this rooting reflex that they'll just go towards whatever, right? Mm-hmm. And so you're trying to latch the baby, and the baby is not going to come straight on. The baby's going to come on sideways. So really focus on this and get that baby to come on with that wide open mouth, having that baby close together against you, really close.
Great. Yes. And we actually have a video in production right now where Sheila's going to talk in depth about latching. So if this is something that you're struggling with or wanting to investigate further, and we encourage you to subscribe to our YouTube channel, and then you'll get a notification when that goes live. All right. Next up is for our mama, Amy. She says, my baby is more interested in the bottle and only wants to feed on one breast for about 5 minutes tops. Sometimes he'll feed longer at night or in the morning when he's tired, but in general, he gets eager and just wants the bottle. I'd really like for him to stay interested in the breast as well. And I know that Amy is not alone in this. So
Amy, I wish I could have a conversation with you right now to ask you more clarifying questions. I bet you this is an older baby. So this is a question I get with babies who are over 3-4 months old. One of the things that surprises parents is sometimes babies can nurse in 3 to 5 minutes. They're more efficient. Letdowns are stronger. Babies can just get on and do their business. So sometimes 5-minute nursings can be all right with an older baby. Of course, we'd want to make sure their weight gain and everything is good. I've done many weighted feeds where we weigh the baby before and after, and we found the baby took a ton of milk in very few minutes. And it really was surprising because the parent was used to this baby like nursing a half an hour, 45 minutes at a shot, and now the baby is more efficient. So babies will take bottles, most of them, much more readily than the breast, because the bottle is kind of fun, right? It just goes in the mouth and it hits the palate and it triggers the sucking reflex, and sucking like fixes their world. So they'll get on and they'll just suck away. Maybe they're sucking on the bottle because they wanted to fall asleep, or they wanted to kind of help shut down, or they had a tummy ache and they were trying to suck to get rid of that. So there's so many reasons. So if you offer a bottle after a feeding and it's not a weight gain issue and it's probably an older baby, they're all going to take it. And then it makes the parent feel like, what's wrong with me? So with older babies, sometimes what I see is what I call hit and run nursing sessions, where they kind of get on and nurse for a little bit and then get off, and they're looking around, distracted. Maybe a little bit while later, they'll get on again and they'll nurse. And their best feedings are usually around sleeping time. So like with the morning naps, maybe when they first wake up, and maybe when they go to bed, or maybe in the middle of the night where they're still sleepy, they'll probably nurse better. And she did say here, when he's tired.
Yeah.
I'm sure that's one of the factors. I do think that trying to avoid the bottles is probably a better solution, because it does become more habit forming if the baby gets used to getting a bottle after every feeding. So unless there was a weight gain issue, I would try and avoid doing a bottle, and just trying to limit the overstimulation in the environment. Maybe go lay down and nurse the baby, kind of mimic when the baby's a better nurse, or like look at what that situation is. Is it dark? Am I nursing in a certain position? Try to mimic that.
Mm-hmm. That's great. All right. Thank you, Sheila. And we're going to go back to Gia because she has another question. She has a baby due in 2 weeks. Congratulations.
Oh, exciting.
Yes, we love this. And we want to know what your thoughts are, or if you can elaborate a bit on why it's best not to introduce formula in the first few days. We want to hear it from others besides her mama.
I get that. So here's the thing with formula. I'm not anti-formula. There's a time and a place for formula, but we want to give breastfeeding a chance. And if we introduce formula right away, it will impact your milk production. Because what will happen is, we talked about this baby's tummy being the size of a little blueberry. The first milk is the colostrum, and the baby's only meant to get a couple teaspoons, just enough to kind of coat that tummy, get the good antibodies in there, and get the tummy lining growing. It's prepping the gut. If you're introducing formula in place of that, the tummy's not going to get that good prep. So unless there's a medical reason, if we could just expose that baby's gut to breast milk, it's better. If the baby has a little bit of a low blood sugar, we could hand express and try in a teaspoon and give the baby a little bit of express milk. Some hospitals use a glucose gel, and some even do IVs, as opposed to just downing a bottle of formula. Because remember, babies will suck because that's what fixes everything. When I worked in the hospital for 21 years, I'd come in the morning to do rounds, and I'd see these parents with these brand new babies, and we would try to latch, and the babies wouldn't latch. I couldn't wake them up. And then I'd find out that the baby had a bottle of formula, like maybe even 10 hours earlier. So here we have the little tummy that's the size of a blueberry, and some well-meaning nurse gives this baby 2 ounces or 3 ounces because the baby was crying, and the baby is like in a milk coma. That little tummy that was the size of the blueberry is now overly expanded, and the baby has to shut down to sleep. So there's so many reasons early on we want to just let the breastfeeding do its thing. Let's see how the baby does, and only use formula if there's really a growth issue, so we can make sure that we give you the chance to have a good milk supply. Yeah.
Mm-hmm. That's great. Yeah. Thank you, Sheila. Gia, congratulations, and our thoughts will be with you for a healthy delivery and a new little baby girl in your life. We're excited for you. Alrighty, and now we have another question from our live stream from Fian. And Fian, thank you for your earlier question too about latching. This question is about pumps. What is the best pump to get? How do you know if it's good for you? She has back pain and nipple pain and was told pumping shouldn't hurt. All right, what can we do for Fian?
So it looks like there's a couple questions here, and everybody's going to have their own personal relationship with their pump. And so what might be the best breast pump for one person may not be the best for another. So I would say we do a whole class on choosing your breast pump. But what I would say is it depends on your situation. If you are going to be exclusively pumping and not breastfeeding, I could tell you 100% I would go with a hospital grade professional rental pump. And the 2 brands that we recommend are the ones that are in the hospitals, either the Amvita Platinum. And so if you're delivering in a hospital, these are the ones you're going to see, or the Medela Symphony. Those are like $3,000 pumps, the giant motor. It's all one motor basically. And then you get your own personal attachment kit. So everything is separate. And that is like a workhorse. That pump is more efficient. Those pumps are more efficient. They're more comfortable because they have a really smooth suction curve, which means there's less trauma to the tissue. So if you're exclusively pumping, or you have a premature baby, or there's a reason why the baby's not latching, you're going to use something like this. If you're looking for a personal use pump, there's so many options. So most people are getting those through their insurance. So you would need to see what your insurance is providing. But if you go with the name brands like the Spectra, the Amita, or the Medela pumps, most likely you're going to be in good hands. And those are more personal use pumps that you're going to plug in. If you want hands-free pumps, there's a lot of options now. One of the ones that we have really good luck with is called the LV pump. And that one is completely hands-free. It's a wearable. You actually put it in your bra and it pumps. Now, I wouldn't do this in place of a hospital grade pump. If I was pumping exclusively, I would do it on top of that. But if you're just pumping once in a while, the LV or one of these personal use pumps are going to be great. I do see here you're talking about a lot of back pain and nipple pain, and you're told pumping shouldn't hurt. You're right. If pumping hurts, there's something wrong. Either you're using the wrong pump, or you have the suction on too high, or the breast shield, which is the piece that goes against your breast where your nipple goes in, is the wrong size. And if any of that's happening, I would definitely reach out to a lactation consultant so he or she can help fit you with the right size shield, and also make sure that you're using your pump correctly.
Yeah, that's good. Thank you, Sheila. Thank you, Fionn. Good luck. And if we can help at all, and for all of our audience, Healthy Horizons does provide breast pump rentals and sales. And so if that's something that you need help with, you can head on over to our website and we'll get you squared away. All right. Oh, goodness. Lots of great questions. All right, Brittany, in regards to pumping, while we're on that subject, how do you know what size to choose for your nipple?
So what Brittany's talking about is just what I was talking about, which is the breast shield, or the phalange, it's called. And people just can't look at their breast and their nipple and say, oh, I am this size. Because what happens is when the nipple is in the chamber and there's pressure, so there's suction, right? There's negative and positive pressure. So the suction, after several minutes, the nipple can change and kind of swell inside the chamber. And so what we thought might fit may not fit. So what I tell people is you want to be pumping for at least 5 minutes to kind of see if you're rubbing. If the nipple is turning white, we call it blanching, and kind of getting jammed in the middle, we know that it's too tight. It should move really freely within that breast shield. So we know that it's too small. So you're going to want to go up at least one size. And the size is usually increased by 2 millimeters. So for example, if you're using the Medela, they'll come with a 24. I would probably at least go to the 27 and see how that felt. If we're still jamming, then I'm going to go up to maybe the 30. These shields go up to size 36. If so much of your tissue is going in and it's really rubbing against the areola, we probably need to go down a size. And so there's a couple options. One is you could try an insert. So Bojin cushions makes these little inserts that are they're silicone. They're so soft and squishy. They're like little cushions. It goes right inside the breast shield, and it reduces that chamber by a couple millimeters. And sometimes that makes all the difference in the world. So if too much of your tissue is moving in or pumping's uncomfortable, you could try this cushion. If you're still having so much tissue move in, you need to go down another 2 millimeters. So it's really kind of trial and error. And then the other thing that people don't realize is that each side can have a different size breast shield. So you don't want to just be one size fits all. You want to really make sure on both sides you're taking a look. And this also might be something that if you're having trouble with, you'd want to have a lactation consultant help you out with, because pumping should really not hurt.
Yeah. All right. Thank you, Brittany. Good question. All right. Let's see. Okay. Now a question from Katie. When should I start pumping and how often? What do you think, Sheila?
Yeah, it really depends on the situation. I know that's probably not the answer people want to hear, but if breastfeeding is going really well, baby's latching, gaining weight, I wouldn't start pumping for a while. Let the baby regulate your milk supply. This is if things are going well. I'd probably wait about 2.5 weeks, and then maybe pump once a day, maybe in the morning, about a half an hour after a feeding. The baby's settled. Maybe you've had a chance to eat something and actually use the restroom, take a shower, relax a little bit, and then I would pump. People tend to have more milk in the mornings, so that's why we suggest the mornings typically. And I just would do it once a day, just to start off with, to kind of get used to the pump, make sure you have the right size phalanges, kind of get used to the rhythm, and you can start collecting and storing milk that way. Once you get into kind of a routine, some people do add another pumping session throughout the day, but if you add too many pumping sessions, you could ramp up your milk production so high that you could have oversupply, which has a whole nother host of issues. So I would start that way.
Okay, good advice. Thank you. All right, and Amber. Amber's asked how long to typically breastfeed, and I'm not sure if she's speaking about during a session or, at what age do you discontinue breastfeeding, or do you?
So how about if I just answer both questions?
Okay, pick your favorite of both. Yeah.
No, might as well answer both. Okay, so let's start with the question, like how long, like how many months or years? Let's start with that.
Okay.
So the American Academy of Pediatrics recommends 6 months exclusive. That means nothing else passes that baby's lips for 6 months. 6 months exclusive, at least 1 year and beyond. Okay, American Academy. The World Health Organization says same thing about the 6 months. Nothing else passes the baby's lips for 6 months except milk. And then 2 years or beyond. So what I'm going to say, it's up to you. It's up to your family and what works for your lifestyle. The worldwide average is probably close to 4 or 5 years. And breastfeeding a 2-year-old is nothing like breastfeeding a 3-month-old. The baby might be nursing once a day for literally 2 minutes. Maybe once every 3 days for 2 minutes. So it's a very different situation as the child gets older. It's not this time-consuming every couple of hour situation that we have early on. So how long do people typically breastfeed? Like a session? Early on, a session could be anywhere from 30 to maybe 50 minutes. Why? Because the baby's learning how to nurse. And the baby also, they're very sleepy in the beginning. So they'll get on and they'll nurse, and then they'll literally nurse themselves to sleep. And you're like, hey, you're not done yet. So then you're trying to wake this baby up, get the baby up, and then you put the baby on the other side. So this can take a while. As the baby starts to wake up more, which usually happens around 2 to 3 weeks, this usually gets a little bit shorter. And as the baby gets older, as we talked earlier, it gets even shorter, sometimes down to 3 to 5 minutes. So the average breastfeeding length is 16 minutes from research, just to let you know once breastfeeding gets started.
Those are really good benchmarks. Good to kind of have a sense of the mins and maxes there.
Right.
All right. Good question, Amber. Let's see. Brittany has asked, how do you know if you have the best latch? We've got a couple of questions here. I'm going to read them all and then we'll kind of dissect. How can you tell if baby is drinking enough milk? And, oh, poor mama, is it normal to have chapped, bleeding nipples in the first month? What can we tell Brittany?
Well, that would probably tell me it's not the best latch.
Okay.
If we're seeing chapped and bleeding nipples. And it may be nothing that you're doing wrong. You may be doing everything right, Brittany. It may be that the baby is latching shallow because maybe the baby has a little bit of a tongue tie, or the baby feels more comfortable latching more shallow. We need to see what's going on with the baby and with you. A good latch, really, maybe when the baby first starts breastfeeding, even with a good latch, it could feel a little like, oh, because you're not used to somebody grabbing onto your nipple and chomping away, right? But typically, if the baby's on deep enough, you should feel a tugging sensation. It should not be flicking, biting. You should not have scabs on your nipples, definitely not bleeding nipples. So if I'm seeing that, we need to get you some help. Somebody needs to make sure that there's nothing going on with that baby like a tongue tie. And somebody needs to make sure that baby's able to latch deep enough. So we want to look at that. Sometimes it becomes like a cycle. So let's say there was trauma in the beginning because the baby was learning to latch. It gets corrected, but we never let the nipple heal. Mm-hmm. So we have to make sure that we give you a chance to heal. So a practitioner might correct the latch and then maybe refer you to your doctor to get some sort of ointment or treatment. There's an ointment called all-purpose nipple ointment that has like an antibiotic and a steroid and some other, an antifungal, and it helps with the tissue healing. That would be something a doctor would prescribe. So we'd want to make sure that we cure you first. We take care of that and then get that baby back on latching well. Sometimes people will pump during this time just for, a couple of days, just to kind of get the face of the nipple a little bit of a rest. And then I saw the other part of that question was about milk. How do you know if the baby's getting enough milk? Mm-hmm. And again, that's going to be with weight gain and output. Is that baby gaining at least that 4 to 7 ounces a week? Is the baby having plenty of wet diapers? So we're not talking babies the first couple of days. We're talking babies over 5 days, 6 days. We want at least 4 to 6 good wet diapers and at least 3 or more yellow seedy stools with that weight gain.
Okay.
Yeah. So, hope you feel better.
Yeah. Brittany, we're thinking about you and you and your nipples.
Brittany, there's this great product out there. It's by Amita. It's called Amita Comfort Gels. I love those for cracked and bleeding nipples because it's a hydrogel. And basically a hydrogel is like a saline solution that's like been solidified, like kind of like a jelly. It's like a little round circle. And you put it on your nipple and it creates a moist wound healing environment to help that tissue heal. It's fabulous. It probably has saved so many moms. And you could put them in the refrigerator in between and then put them on afterwards and they're cooling. Oh, it's such a pain relief. It's so wonderful. You can use them for up to 6 days. You just want to make sure that you clean them just before you put them back in a little plastic sleeve and put them in the refrigerator. But they're fabulous and you could rinse them. Please avoid using ones that will have cloth backing. There's products out there like that. Those you can't clean. And they're only really good for like 12 to 24 hours. And I don't want, that could be a source of bacterial growth. So the Amita Comfort Gels are bacterial and fungal static. They don't promote the growth of those. So that might be something that might help while we're correcting the latch and healing your nipples.
Great suggestion. We have reached the end of the time that we have available today. This has been such a good session. Thank you so much to all the moms that submitted your questions and entrusted us with coming along with you on your breastfeeding journey. We hope that this was helpful for you. Sheila, thank you for lending us a bit of your 30 years of experiences in the IBCLC and for all of the advice that you were able to share with our moms today.
Jenny, no, thank you. And I know there were more questions, so maybe we could talk about doing a part 2 so we can make sure we really address people's concerns.
Yes, that sounds great. I think that would be welcomed by our community is my guess. If you think that would be helpful to you, definitely give us a shout and let us know if you would be interested in participating in a second session with us.
And then just one last thing, some of the products I mentioned are available on our website, just like the breast pumps that Jenny recommended. So I would check it out and see. Thank you so much, everybody. It was really a great pleasure doing this today.
Thank you so much, everyone. Have a good rest of your day and best wishes for your breastfeeding journey with your little ones. All right.